Hi, I'm Dr. John Willardson, and thanks for watching Trust TV. I founded Trust Implants way back in 2001, and we have been restoring the lives and smiles of our patients from the beginning. As the founder of Trust Implants, I'm excited to announce the expansion of the Trust Implants network throughout the United States. We are especially excited to announce our Las Vegas affiliate specialists. Now you can experience the same beautiful, high-quality, life-transforming smile restorations we offer all of our patients at each Trust Implants location. Now there is a doctor who you can trust with your smile here in Las Vegas. We have sought out and found the most qualified surgeons in the area to assure that you will have a positive and successful experience. Thank you for watching and stay tuned.
Hi, my name is Eric Brown, and I'm excited to introduce you to Trust TV and the life-changing procedures that are brought to you by the doctors of Trust Implants. Today, we'll be hearing from these doctors that provide these amazing life-transforming results. Trust Implants, with their techniques and procedures used, are transformative, and today we will get to witness this over the course of the next half hour. Also, we shall talk to and hear from some of the patients that have been recipients of these amazing Trust Implant procedures. So, stay tuned as we introduce Trust Implants and the wonderful doctors, techniques, and patients who are key to their successes. Joining us today is Dr. John Willardson, founder of Trust Implants. Dr. Willardson, if you can tell us what makes Trust Implants unique, particularly in the world of smile restorations and life transformations.
Thanks, Eric. Thanks for having me on the show today. So at Trust Implants, we look for the most trained and qualified surgeons in the country in order to provide these procedures and techniques to transform the smiles and the lives of each patient that comes to the Trust Implant Center. You know, it's important because unless you've lost your smile, it's hard for us to relate or understand what that means. But the patients who have lost their smile, their confidence, their ability to chew and eat, they can relate to this show because they know what's lost in that process. They're fearful of going into social events, they maybe are fearful of getting a new job. So there's a lot of variables that unless you've lost your smile, that you really can't appreciate. But at Trust Implants, we are able to restore that smile and that confidence and restore we're restoring their life back to what it was prior to losing their smile.
Are there any other detrimental effects that some of the people that you have spoke with mention as they're thinking about doing this?
Yeah, you know, aside from the digestive issues, confidence issues that come along with teeth that are missing or a smile that's been lost, you know, I've had many patients who they've not been able to be in a relationship with somebody simply because they are so not confident with their smile. I've got one patient who, you know, he and his wife hadn't kissed for 10 years because she didn't like the way it smelled or they didn't like the way it looked. And after we restored his mouth, it was amazing because I have a video of this, of them kissing, and she was just like, this is the greatest thing ever, because after 10 years, you can imagine, you know, some of that intimacy is lost only because of their smile.
So if someone has lost their smile, how does that affect their everyday life? Talking, eating, whatever it may be.
Yeah. Oh, it affects them tremendously, Eric. You know, one, just their confidence, which I feel is such an important aspect. You know, we all want to feel good about ourselves. We want to have that confidence. But when the smile is lost, that goes out the door. But also, if you look at like an overall health perspective, you know, digestion, you know, a patient who's missing teeth, multiple teeth, they look at a menu at a restaurant very different than you or I do. I don't think about anything on the menu. I can eat basically anything that is on the menu because I don't have any teeth that are missing. But somebody who's wearing dentures, partials, or missing teeth, there's very few things on that menu that they can eat. Not to mention how it affects their digestive system. Our mouth is the beginning of our digestive tract. If we cannot chew or masticate our food properly, lots of things can happen. Diabetes, or they're kind of stuck in a high carb, high sugar diet because they simply cannot chew their food. And so there's a lot of reasons why, not just aesthetics and cosmetics, a lot of reasons why it's very important to have your mouth intact so that it's perfectly balanced and aesthetically regaining that confidence that you lost if you've lost your smile.
I mean, to use the words life transformation is 100% accurate.
Every single case, I watch this transformation that is so amazing to be a part of.
Now, it has come to our attention that the Dental Board of California has contacted you directly regarding hundreds of patients that could use some critical attention. Can you tell us about that situation?
The situation with that was there were multiple large implant centers in our area that the doctor was taken out of the practice and they were shut down. There were patients that showed up to the office and the doors were locked. And they were in the middle of treatment. They had started their treatment and it wasn't completed. There were cases that were, prosthetics that were breaking, implants that were failing. So the dental board contacted me to come in and resolve and help them with this situation, because what happens is when the doctor's out of the equation, then the patients become a ward of this dental board. So they contacted me, and through that process, I was able to help thousands of patients get back to the recovery and feeling good about themselves and their smiles.
Now let's hear from one of Trust's patients about how they are extremely satisfied with the personalized procedure that was tailored for them.
Back in 2016, I was in a near-fatal motorcycle accident. I was T-boned at about 65 miles per hour, going through a green light, guy ran a red light, ran over my head, cracked my helmet, put me in a coma for about a week and a half. I cracked a whole bunch of my teeth.
He was pretty down and out. He was very frustrated because he could not eat anymore. He couldn't smile. And you can take a look at his before photo and you can see how broken down everything is.
It's because my cheek had blown up, my eye was swollen shut, I couldn't see out of my right eye. Because it was horribly infected. I was getting sick constantly because of the teeth being exposed.
That's where we started. We went ahead and put a treatment plan together to start removing the root tips and placing dental implants so that we can reconstruct his mouth to a normal, natural, beautiful aesthetic result.
But now I can chew in the back. Like last night I was finally able to eat something for like the first time in forever without hurting my gum line by chewing on an implant. No, it's epic. Oh my God, it's amazing.
We were able to place 8 implants in the upper jaw, 6 on the lower jaw, and as a result, we were able to restore his mouth back to perfect aesthetics and function.
Now I can actually live, I have confidence, I can smile. I haven't stopped smiling since I got my teeth.
The biggest thing is that smile that he won't stop showing people.
We've watched his transformation, everything from not just his smile, his mouth, and his confidence, but he's had a major 180 shift in his life. He's gotten a new job, he's living in a new state, and so it's been wonderful to watch this process.
I think Trust Implants is probably the most fitting name for his practice because he's the only one I would trust with my mouth.
Most other dental offices utilize a 4-implant approach, especially when doing a full set of teeth. Do you utilize a similar 4-implant approach?
We don't. We actually use what's most appropriate for the patient. So if the patient needs 6 implants or 8 implants ideally, we want to provide long-term successes. We have cases, we have a case here that dates all the way back to 1999 that I did as a resident. And these are the long-term successes that we're after. And a lot of times, utilizing just 4 posts or 4 implants to support 14 teeth is not sufficient. And that's one of the things that I found when I helped the dental board with this process, because they mainly only did the 4-implant approach. And I found that biomechanically it just is not favorable. The teeth were breaking, implants were breaking. And so we actually like to provide more support, more posts or implants to support a full arch of teeth.
As Trust Implants is expanding into other markets, there might be critical things that you look to impart upon new patients in those markets. What type of things are most important for Trust Implants and their patients?
Yeah, that's a great question, Eric. It's critically important that we maintain the trust with each of our patients. And we want to use the highest quality implants, the highest quality materials all the way to the graft materials that we use, the type of grafting materials, the type of implants, the type of materials for the teeth or the prosthetics. It's all tied together so that in the end we can have cases that are 15, 20, 30 years old and they look the same as they did the day we put them in.
Now let's hear directly from one of Trust's patients who has had an amazing dental procedure and how it has changed their life.
I grew up with seizures starting from like puberty, and so I used to have a beautiful smile, and then I started having these seizures, and when you have a seizure you bite down really hard, and it was fracturing my teeth, so I started losing pieces of teeth. I would lose the whole tooth itself, and so just a lot of dental problems from that point on, from pain to not being able to smile. Like when I smile, we've done some, but really like when I smile, I go to the side and like my daughter goes, "Oh, you're a pirate, you look like a pirate," and I do, so that's our little joke, is like arg. But it's funny at home, but it's really not. It hinders, my self-esteem is affected. When I'm out and I'm with friends and I go to laugh, I'm covering my mouth and I feel insecure about the way that I look, and it's uncomfortable.
Here she's missing teeth in multiple areas, and so we've replaced those missing teeth with dental implants. So we're going to prepare the natural teeth as well as finalize the implants so that her smile and the aesthetics and the bite is restored. So she'll have a beautiful smile, and this will make a tremendous difference for her, a major transformation.
I'm just excited to finally be able to smile and laugh, to be able to chew and get out of pain and know that these teeth aren't going to break.
Our goal is to restore the aesthetics so it looks beautiful, as well as the function, so that when she chews, she's chewing equally on both sides. She's not having to choose one side or another. She is, feels balanced, because if you have any imbalance, something feels off. It'd be kind of like if you had a pebble in your shoe and you went to go for a 5-mile run. You know, your body will adapt to that, but it's not good for your knees and your hips and everything. Exactly the same thing with our teeth. And once the imbalance is corrected, it's noted. Our mind recognizes the correction of the imbalance, and it really puts us all back in line. So the replacement of missing teeth is very critical, actually, to have that balance restored.
If you live here, you know exactly who he is, and that's who you want to have your teeth done by. You want Dr. Willardson. So I just was so blessed to be able to get in and have his help, and he agreed to take me, and such a godsend.
The emotion behind when she first came in, she was very, very shy.
I'm finally doing it. I'm so excited.
Okay, we're done. After 8 hours. How many hours has it been? Almost 8 hours.
You've been gone for a while. You're like, what happened? Where I've been? We've been working so hard on you.
You good?
He gave me a smile and self-esteem all in one.
That's right.
I just feel like going.
I have to confess, I hear from many of my family members who are terrified about the prospects of going to the dentist, and it's mostly revolving around pain and discomfort. What might you tell them?
So that's a real thing, Eric. You know, I'll have patients that a lot of times it's hard for them to even come into the office. If it's a new patient and they've had bad experiences in the past, or whatever the case may be, a lot of times it's just them feeling ashamed of their smile or their teeth. And again, we manage each case individually. We tailor the anesthesia, whether it's general anesthesia, sedation, so that we can alleviate those fears and get done the steps, procedures, and techniques that will transform their life and transform their smile. And so we tailor the anesthesia and the anxiety control and management according to the needs of the patient.
That sounds amazing. So I'm hearing from other dental centers that they are preaching this concept of a process completed in a day. Are you finding that you follow along that same expedient, get everything done in one day?
Now, that's a great question as well, because it is kind of the trend right now to put the implants in and put the teeth on in the same day. Those teeth are always a temporary. It's not the final set of teeth. And absolutely, we do that in our practice. But we're not marketing to every single patient that we are going to put your teeth in the very same day, because some patients it's not a viable way to go, because we need bone to heal, we need tissue to heal, we need the implants to heal, and there's no magic bullet around expediting and having the body heal quicker. It just has to take the time that it needs to heal. For example, a patient who's diabetic and their healing is slower, we want to be clear and honest with each of our patients so they understand that yes, it is possible, but it may not be the best thing for them given their situation.
Well, and my guess, our viewers would love to hear that their individual treatment is personalized to whatever it is that they need.
Absolutely, because we can't put all of these, every patient is different. Every patient that I work on, that I'm able to treat, I have to kind of navigate what's best for them as I'm going through the process, because it really is a process. It doesn't just happen overnight. And so I'm not a big fan of the idea of that it's you come in and you go out with and it's done, because that's really not the case.
That's fantastic. Trust Implants and its partners can give you that life-restoring smile makeover that you've dreamed about and make it a reality. If you want your beautiful smile restored, your confidence restored, and just looking and feeling amazing again, Trust Implants has restored thousands of people's lives with a newly restored smile. So Trust Implants empowers multiple dental facilities across the country, and you've developed these really wonderful partnerships with renowned surgeons across the country. Can you tell us a little bit about those partnerships?
Yeah, these partnerships are what make Trust Implants, because we seek out the most qualified, trained, university bona fide trained surgeons that are capable of providing these procedures. It's really important that you find somebody who is skilled at and that knows how to do these procedures. So again, we're looking for the long-term success. We are always focused on that. And so we seek out and team up with the most qualified, skilled surgeons in the country.
Now let's listen in on a patient who has had this life-changing procedure and can now live and eat and smile without limitations.
So what I really feel bad for, I know for every person that comes here and gets it fixed, there's probably 50,000 that'll never even think about coming here. They'll either have some crappy dentures like my dad had his whole life, or they'll just do what I do. They'll just suffer and eat what they can, and I can't tell you how much, there's the other thing, I can't tell you how often I choke. I choke all the freaking time.
Well, that's not good.
And it's choke because I can't chew enough.
Yeah, you can't masticate the food properly.
I chew at my front teeth.
And they're not designed to chew with the front.
Right. And
you swallow too large of a portion.
Correct. All the time.
Yeah.
I would say on an average of a couple, 3 times a day. I've learned to relax and cough things up.
Yeah.
And that's not a way to live.
You ready for this? Of course, always. Oh yeah. Okay, so here we've got our patient here where the teeth are actually fine. If you'll notice here, the teeth are okay. However, it's the supporting structures underneath, the bone and tissues, that's not okay. You'll notice the mobility here of the teeth, down here. I mean, these are basically ready to just come right out. So, and it's everywhere. So there's no way to save this situation or try to restore his natural teeth. So we're gonna go ahead and get started and remove these teeth, which is gonna remove the bacteria, remove the infection, and it's gonna really help him even systemically, because having this bacteria and infection in his mouth long-term or chronically is not good. It can trigger a stroke, heart attacks. It's just not good to have this in his system all the time, lingering in his mouth. So we're going to go ahead and get started. Everything looks good and his bite looks good. And so we're done for the day. It's good. This case is really challenging because he lost the bone all the way to the tip of the root, which is 12 millimeters or more, 15 millimeters of bone. And so it's a challenging case, but we can handle anything. We can, that doesn't stop us. It doesn't really delay anything. We're able to manage and grafting is critical, and it's important that we know how to do that in order to handle these sort of cases. And so even though he had lost all that bone, I'm very confident in regenerating that bone so that I can ultimately give him a fixed permanent set of teeth that will last him the rest of his life. Nice 8-hour surgery today, and now we're done.
Dr. Willitson, you've mentioned this idea of materials. What's used as someone is having implants done. Aren't all materials just the same?
Well, actually, no, they're not. There's a lot of variations in materials, and we find and utilize the very best implants, grafting materials, materials for the prosthetics, because again, we want those long-term results. And between the proper planning, selecting the proper materials, and then execution on that, we are successful in obtaining cases that will last the patient a lifetime. Some of these large corporate implant centers, a lot of times the doctor's not the owner, so he really doesn't even have a choice as to what system or what implant, graft material, or prosthetics that he uses. He's basically dependent on whatever the office has or whatever they've made a deal with one of these implant companies so that they get a lower price, and it's all based on price. At Trust Implants, we don't do that. We use the very best materials because we want that long-term success.
Well, and when you think about if someone is really looking at making this life-transforming change in their smile and their appearance, and you've touched on this idea of world-class materials, world-class surgeons, it sounds like this is something that is perfection for someone that is in need.
Absolutely, because again, it is an investment. And so we want to provide the very highest materials and quality and technique, skill set surgeons so that we also can protect that investment for the patient.
So some viewers that are watching this right now might decide that they have a need, but think that this is not at all affordable them. So can you talk a little bit about the rates and if there are financing options?
Absolutely. Again, as I had mentioned earlier, it is an investment, but it's an investment that can last you a lifetime. And the transformation that occurs when the patient starts and then we complete their case, there's no way to put a price on that. We do have financing options. We do have ways to kind of stagger it so that the patients get the quality materials, techniques, and ultimately transform their life with their new smile. So yes, we do have financing in different ways to get creative so that we can offer this to as many patients as possible.
That's great to hear. So there are thousands of different options in the dental implant world that someone can pick from as far as a provider. What would make someone want to pick Trust Implants compared to all of the others?
It's important that we collect all of the data that we've generated over the last 20 years, and we apply that data and that information to the offices across the Trust Implants network. As I had mentioned earlier, we seek out the very top surgeons as well as providing the very top materials and techniques. And in the end, this is what gives us our successes, so that when we have patients and they finish their cases, they can have confidence in the treatment that we've provided.
That's wonderful. With more than 3 decades of dental experience, Trust Implants and its partners use a state-of-the-art practice to provide a 5-star dental implant experience unlike any other. They have personally changed many lives for the better as they create a new smile for you. Dr. John Willardson completed his residency training at Loma Linda University Center for Implant Surgery and Prosthodontics. Here he was able to focus and gain a complete grasp of the entire implant process, understanding the planning, all aspects of the surgical phases of treatment, and all aspects and options for the prosthodontic treatment. Having a doctor who handles the entire process is critical for patients who need dental implants. At Trust Implants, you will only be seen by one doctor, which will start and complete your procedure because the business is owned and operated by he or she. This is what sets them apart from most other implant centers, which usually have multiple doctors completing the procedure. Trust has specialized in implant surgery and implant prosthodontics for over 20 years. Trust only partners with the most highly trained surgeons who have years of experience in comprehensive, full-mouth restorations with thousands of satisfied patients. Dr. Willardson, we have visited your website and we've seen some wonderful testimonials from some of your patients, past and current. So can you tell us a little bit about some of the folks that you have worked with?
Yes, so we have the most wonderful patients. Because it's a relationship, you know, it's not a one and done type of a situation. When we finish a case, they're part of the Trust Implants family, and we see their cases through to completion and make sure that they're completely satisfied with the aesthetics, the way it functions, and what they have, you know, put their trust in us to deliver when we're finished. But even then, once we're done, they're still part of our family, and we see them on recalls, we see them to make sure that, you know, everything's okay. So it's been a fun process. I love being part of this transformative process and watching them come in kind of down and out and defeated a little bit, if you know what I mean, and then finishing their case and they're radiating, they're glowing because they have this newfound confidence. The restoration of their smile and ultimately their life is such a great thing to be a part of.
If someone is watching this program right now and would like to learn more about the Trust personalized process or the dental services that you offer,
right,
can they log on to your website and connect with someone, or can they call and speak with someone fairly quickly?
Because Trust partners with the highest quality surgeons throughout the country, they can go to our website. On the coverage area map, they can choose their location and find one of our partners who's in their area and go in for a consultation and put a plan together so that you can start to solve the problem that you're having with your lost or broken smile. I can assure you that once they take that initial step, it is just a wonderful, transformative process that they will never regret that they have taken. So visit our website, find a provider in your area, give them a call, and get in and start the process.
Thank you, Dr. Willardson. It sounds as if Trust Implants is really the place to begin a life transformation experience.
Yes, it really is. You know, we are passionate about providing these services for our patients and transforming their lives and transforming their smiles.
And thank you for tuning in to this episode of Trust TV. If you're interested in learning more, visit at trustimplants.com or schedule a call on the number on your screen to begin your life transformation today.